March 24th is celebrated as World Tuberculosis Day. Tuberculosis is a specific infectious disease which is caused by Mycobacterium tuberculosis. The disease primarily affects lungs and causes pulmonary tuberculosis. It can also affect intestine, meninges, bones and joints, lymph glands, skin and other tissues of the body. Pulmonary tuberculosis is the most important form of tuberculosis. It remains a worldwide public health problem despite the fact that the causative organism was discovered more than 100 years ago. And highly effective drugs and vaccines are available, making tuberculosis a preventable and a curable disease. India is the highest tuberculosis burden country in the world in terms of absolute number of incident cases that occur each year. In India, tuberculosis is more prevalent in adults than in children. It affects adults in the most productive age group, that is 15 to 54 years. In this video, we are going to present the causes, the stigma, diagnosis, treatment and prevention of tuberculosis.
Dance wala, it's so cool, you know, like
it's so nice.
So nice,
it's crazy. Hey, what happened? I don't know, I have coughed in so long.
Nikita, why are you coughing so much now? What happened? क्या होता? खांसती रहती है दिन भर दोस्तों के साथ घूमती रहती है ये लोग, और ये देखो दिन भर उल्टी करती रहती है. क्या हुआ? What happened? Why are you coughing? You're coughing like this in so long. Oh shit! You have fever also. Why don't you just go meet a doctor? Bus is always late. Yeah, I should go home early. Oh, this bus too. Hey, what happened? They always coughing. Yeah, first that Sushmita was coughing, now you are coughing. No way. Arey, why don't you consult the doctor?
Good afternoon, doctor. Good afternoon. What happened? I'm suffering from cough since long time. Since when? Since 1 month. Okay. Is the cough associated with sputum? Yeah, it's associated with sputum and it's sometimes blood tinged also. Okay. Do you have fever? Yeah, I have fever. It's getting worse in the night time. Okay. Are you taking any medication for fever? I have been taking paracetamol, but it's not at all reducing. Okay. Did you check your weight? Yeah, I was around 50 kgs. Can you please check it now? It's 45, ma'am. It seems that you have reduced weight. Let me examine. Breathe in. Return. Okay. Let me write some tests. Based on the reports, I'll give you the medication.
For any patient who comes with cough more than 2 weeks, sputum examination and chest X-ray have to be done. 2 sputum samples, that is early morning sample and spot sample, have to be collected. If smear is positive for tuberculosis and chest X-ray is suggestive of tuberculosis, then it is microbiologically confirmed TB. If smear is positive but chest X-ray is not suggestive of tuberculosis, then also it is microbiologically confirmed tuberculosis. If smear is negative but chest X-ray suggestive of tuberculosis, then CB NAT has to be done, that is cartridge-based nucleic acid amplification test. If CB-NAT detects Mycobacterium tuberculosis, then you have to check for rifampicin sensitivity. If it is rifampicin sensitive, then it is microbiologically confirmed TB. If it's rifampicin indeterminate, then you have to repeat CB-NAT on second sample.
I've seen your reports. It seems that it's a pulmonary tuberculosis infection.
Oh, I got TB.
Yeah, don't worry. It can be cured with medications.
Arey guys, did you hear that Nikita is infected with TB? Oh no, she coughed on me that day. Yeah, stupid girl. Hey, she don't come near us. Hi friends. What? Hi, you are infected with TB and you are telling us hi? Go away from here. Let's she roam with us like
Guys, this is so unfair. You can't do like that with her when she actually needs us. She's taking precautions by covering her mouth with a tissue or hand, and we can also prevent TB by covering ourselves.
For a long time, the standard duration of tuberculosis chemotherapy was 18 months. In 1972, Wallace Fox and his colleagues from British Medical Research Council showed that addition of rifampicin or of pyrazinamide to regimens containing INH made it possible to reduce the duration of treatment. There are a number of advantages of short-course chemotherapy like rapid bacteriological conversion, lower failure rates, and reduction in the frequency of emergence of drug-resistant bacilli. Patient compliance is improved and they become non-infectious earlier. DOTS, that is directly observed treatment short course, is a strategy to ensure cure by providing the most effective medicine and confirming that it is taken. It is the only strategy which has been documented to be effective worldwide on a program basis. In patients with drug-susceptible tuberculosis, 2 months of isoniazid, rifampicin, pyrazinamide and ethambutol and 4 months of isoniazid and rifampicin remains the recommended regimen. The use of fixed-dose combination tablets is recommended over separate drug formulation in treatment of patients with drug-susceptible tuberculosis. In all patients with drug susceptibility, use of 3 weekly dosing is not recommended in both intensive and continuation phase. Daily dosing remains the recommended dosing frequency.
Susanna was saying nothing only that we have friends. Nikki got TB.
Oh, where is she?
She's in the other room. We are not letting her come in this room.
Who told her? Did she go to the doctor?
Yeah, she went.
जाके उसको दूसरे रूम में बिठाओ. ये क्या है? उसको काढ़ा पिलाओ. बाहर मत आने दो.
No, Daddy, TB won't spread like that. We as a family should support her and see to it that she takes medications at the proper time. Let's see to it that she takes proper food and prevent the spread of TB by wearing face masks, especially Bobby because she's pregnant and Dadi
How could you
because
prevent
she's
TB infection? It involves patients and community in advocacy campaigns, infection control plan, safe sputum collection, cough etiquette and cough hygiene. Like, you have to educate the patient that he has to cover his mouth and nose with a tissue when he is coughing or sneezing. And you have to educate, like, cough or sneeze into your upper sleeve, not your hands. Put your used tissue in the waste basket. You may be asked to put on a surgical mask to protect others. Wash with soap and water or clean with alcohol-based hand cleaner. Triage TB suspects to fast track or separation. Rapid TB diagnosis and treatment. Improve room air ventilation. Protect healthcare workers. Capacity building. Monitor infection control practices. Can you imagine a world without TB? Yes, we can. Let's all join our hands together and help the world to get rid of tuberculosis. and bring smiles all over.